While I've been 26 years as Chief Executive in the hospital, for the last 10 years or so, I've realised the importance of culture and values and the importance of treating patients empathetically and sympathetically. And we need to bear that in mind as we attempt to maximise patient flow. Well, we have a requirement every day of 60 discharges in order that we can cope with the number of admissions we have. We have 65,000 patients a year attending the emergency department, and 20,000 of those patients require admission. So you can see there's huge pressure on us to flow patients through the hospital. In addition, we're a major cancer centre, and we need a capacity to deal with those patients coming in. So we require the input of all departments in order to ensure flow throughout the hospital.
The Safer Patient Flow Bundle. S stands for Senior Review. A stands for all patients should have a planned date for discharge. F stands for flow should happen at an early stage in the day. E stands for early discharge, which is aimed for 11 a.m. And R stands for review of patients who are at risk of prolonged stay.
We, the Executive Management Board, are fully committed to enabling and empowering all staff in the wards and the various departments to implement the Safer Patient Flow Bundle.
S stands for Senior Review. It's really important that a patient is seen by a senior member of their clinical team early on in the day. That allows for clinical assessment and for generation of the plan of that patient's care for that day.
So A stands for all patients should have a planned date of discharge. Having a planned date of discharge that has been discussed as a team is very important to highlight when a patient is due to leave CUH, which means that if it's needed, then we can get them followed up with community services in a timely manner. Planning for discharges during the week and especially at the weekends is very important to be highlighting to all the team members, and it should be visible up on the ward whiteboard.
So F is for flow. Now, having visibility of patient flow on the ward whiteboards helps us to place the right patient on the right ward at the right time, hopefully first time. This will help improve the patient journey, reduce length of stay, and indeed reduce mortality. Visibility of discharges from wards early in the day is crucial for this to happen.
E stands for early discharge. Discharge planning begins on admission. Nurses play a key role in ensuring that all necessary members of the multidisciplinary team are involved in discharge planning early. We also link in with community services. This ensures that patients are discharged in a timely manner. Our aim is that discharge is before 11 a.m.
R stands for review. In CUH, the average length of stay for patients is about 6 days. For some patients, they may require longer periods of time in hospital. Review of those patients includes planning for the most suitable subsequent care setting. If this is at home, we ask, do the patient's home supports and home environment meet their care needs? If this is to another hospital, we link with the appropriate healthcare professional there in a timely manner. And if this is to a long-term care setting, we discuss the patient's care with our discharge coordinators.